Hi, my name is Dr. Saimoon Singla, and I am a pediatric rheumatologist and integrative medicine physician. Many times patients get referred to rheumatologists, whether it's pediatric or adult, for something called a positive ANA, and that stands for an anti-nuclear antibody. What does that mean? Does that mean if it's positive, you have an autoimmune disease? Not necessarily. So first thing you need to know is that about 20 to 30% of the population, of the healthy population, is walking around with a positive ANA and they don't know it. A lot of times it's checked because a patient might have symptoms like joint pains or aches and pains, muscle pains, fatigue, and the ANA comes back positive. And so you get sent to a rheumatologist, but really the test needs to be interpreted in the context of what's happening. Because what if you're one of those 20 to 30%, or should you really be worried about an autoimmune disease? So some of the things to look for with the positive ANA that would be more concerning for an autoimmune disease would be things like persistent fevers that aren't due to infection, rashes that are photosensitive, especially right through the cheeks and the bridge of the nose, hair loss, especially through this area, sores in the nose or in the mouth, joint swelling, stiffness, where you have more stiffness or inability to move your fingers or joints in the morning, or you have certain lab abnormalities like anemia or elevated markers of inflammation. Those things all need to be kind of looked at before someone says, oh, you have an autoimmune disease. So everything needs to be interpreted in the context of what's happening with you. And so that means getting a thorough history and documenting exactly kind of how you're feeling and the lab abnormalities that are going on along with the positive ANA.